Are we on the webinar?
The broadcast is now starting.
Excellent.
In listen-only mode.
Good afternoon, everybody. Welcome to the Maricopa County Press Conference for this September 16th. Thank you so much for being with us. We appreciate everybody joining us via the webinar, all the reporters that are on there, as well as county employees and other stakeholders in this effort during the pandemic. Also, those of members of the media that are joining us and members of the public joining us via Facebook and via YouTube today. We appreciate you joining us and listening to the information we have to offer. So today we are going to talk about public health's role in flu vaccinations. We're very aware of the governor's press conference last week. He talked about the importance of this, spoke about flu vaccinations. Public health always has a role in flu vaccine and distributing it to vulnerable populations. And this year the role is going to be much larger as we try to get flu vaccine to many, many more people. So Executive Director of the Department of Public Health, Marcy Flanagan, will be speaking about that. She'll also provide an update on the Serosurvey, which is going on in neighborhoods around the valley right now, even today. So it's going on through this week, and she'll give us an update on that as well. Also today for the question and answer portion, I have Robert Rowley here as well. He is the Director of Maricopa County Department of Emergency Management. As you know, they are part of the Unified Command and along with Public Health and the Joint Information Center where we work, we are supporting them in this effort. So Robert's here. He can take questions about PPE that you might have, also any questions about other logistical operations that are going on for Unified Command. So a couple of quick housekeeping things to mention here, as we always do. Members of the media, if you're struggling on the webinar, for some reason it's not allowing you to virtually raise your hand, or you're unable to unmute your mic, because remember, you have to unmute your mic on your end, and then we'll invite you into the press conference during the question and answer portion. So you might have to log out of GoToWebinar and then come back into GoToWebinar in order to make that work. One final mention here, too. Joanna Molina with us as always. She is a public information officer for public health, and she'll be translating the question and answer portion into Spanish for those people in the Spanish language media and any reporters that need the answer in Spanish, also to benefit those viewers today who might be bilingual or speaking Spanish primarily in their homes. So with that, I will turn the podium over to Director Flanagan.
Thank you, Fields. My name is Marcy Flanagan. I'm the Executive Director of Public Health for Maricopa County Department of Public Health. Before I get started with the two main topics, I'm going to give a brief summary and update about schools and a reminder of how we are working with schools for outbreaks. We work closely with the school health officials and administration to investigate every COVID-19 exposure in a school. It's important for schools and parents to realize and understand that if your child has been exposed to COVID-19 in the school, they cannot return for 14 days regardless of a negative test result. And that's because you can develop the infection for 14 days after the exposure. So if you get tested even a week after you were exposed, you could still develop symptoms and infect the others with the disease. So this is national guidance and a standard from the CDC, and that's what we follow here. So as schools start to go back into the classroom and have students welcome students and teachers back in the classroom, Public Health is partnering with schools with our goal to create the healthiest and safest environment possible for our children to learn in. Now I'm going to give an update on two topics: Maricopa County Serosurvey and getting your flu shot. For the Serosurvey, we want to give thanks to everyone who has participated already and helped us get the word out about our Serosurvey. I want to remind everyone that the goal of the Serosurvey is to help us understand how many people may have some immunity to COVID-19. So as we have the COVID-19 vaccine available, we'll know how many people we need to receive the vaccine to stop the spread of COVID-19 in our community, and that we can relax our social distancing and mask recommendations. It also provides a free antibody test for those who participate so they can learn if they were likely already infected with COVID-19. Again, even if you have already had an antibody test, It doesn't mean that you can't participate in the Serosurvey, and it also doesn't mean that you don't have to wear a mask to protect yourself and others. It just means that you probably already had the disease. We can only accept volunteers from a specific area that were randomly selected by the CDC to participate, which will give us representation sample of our entire county. If public health or ASU volunteers come to your home inviting you to participate, please consider participating, even if you've already had an antibody test. Many people who have already participated said they were glad to have the opportunity to be part of such a large community effort. We are at 38% of our goal of 105 households still needed. We only have until Sunday the 20th to get the rest of the way to our goal, so we need help from everyone eligible to please strongly consider participating. It's quick, only about 20 minutes for a single person, and slightly longer if you have others in your household that participate. You can do it outside of your home or by making an appointment at our mobile medical clinic, whichever you prefer. You'll get your own test results and help inform public health strategies we are developing specifically for Maricopa County. We want this to be convenient and helpful for individuals as they help us understand the needs of our community. If you have questions, please visit maricopa.gov/COVID-19 Serosurvey for more information. Now let's talk about the flu. The flu vaccine is available now in our community, and now is the time to get your flu vaccine for the season. There's several reasons you want to get it now. First is it takes your body a couple of weeks to develop antibodies, so you want to get it before the flu is circulating widely throughout Maricopa County. Getting the flu vaccine means that you are lowering your chances of getting the flu and passing along to others, including those who are highest risk for severe symptoms. If you do get the flu vaccine, if you do get the flu after you've had the flu vaccine, it tends to be milder and you are much less likely to be hospitalized. Fewer hospitalized cases means less strain on our healthcare system when we still have COVID-19 circulating. We recommend that everyone over the age of 6 months get the flu vaccine, with rare exceptions. So talk to your healthcare provider if you have any concerns. There's more COVID testing available now than there was several months ago, and backlogs and results have addressed the average. So, I skipped a page here. There is much more vaccine being manufactured this year than in typical years for the flu. You can ask your healthcare provider and pharmacies or other healthcare clinics if they have it available. Public Health is partnering with many agencies to make it possible for everyone who wants the flu shot to have access to getting it. We are partnering with nonprofits, pharmacies, hospital systems, cities, towns, HOAs, fire departments, and faith-based communities to get the vaccine to everyone. The focus is on those communities that don't have access to the flu vaccine, including those without health insurance or with no vaccine coverage, or those experiencing homelessness. Visit maricopa.gov/flu to see where the vaccine is available. New dates and locations are being added every day. Even though we normally see a peak around January, the peak for flu can come as early as November, so get your flu shot now. And if you get it now, it will last the entire season, so it's not too early. It's especially important for young children and older adults and those with chronic medical conditions, as they are at highest risk for hospitalizations and even deaths. Many people think of the flu as a bad cold, but for some, it can be much worse than that. Nationally, the CDC estimates that an average of 24,000 people die from the flu, and more than 500,000 are hospitalized every year. We want to prevent as many cases, hospitalizations, and deaths as possible in our community, so please get your flu shot. And particularly this flu season, people may wonder the differences between COVID-19 and the flu, and their symptoms can be very similar. So if you or someone you know has symptoms, please get tested. There's more testing available now than there was several months ago, and the backlogs that we had previously with the lab times have decreased significantly. We are now seeing an average of 4 days in Maricopa County for an individual to get tested and have their results. If you have symptoms, please contact your provider for testing or visit maricopa.gov/COVID-19 for testing locations. Thank you.
All right, everyone, that wraps up our formal presentation for today. So at this time, we'll go to the question and answer portion of the press conference. So if there are any reporters on the line, Ron, that have their hands raised, please let us know about the first one.
Yes, Fields. Claudia Rubicic. Claudia, your mic is unmuted. You'll need to unmute your mic. Claudia, you're...
Hey, can you hear me?
I can hear you, Claudia.
How's it going? Yes, this is about the Serosurvey, and I wanted just some clarity. We're halfway through the 10-day collection. I just wanted to get more clarity on the numbers. How many households have been, how many have been gone to? How many samples have you gotten? And do we feel confident you're going to get to the goal, which was from 500 to 1,000 samples?
So how many samples have been collected thus far? Or how many households have been reached? I know that Marcy mentioned 38%, and we are still looking for 105 more households, I believe was the number. And what are our chances of reaching that goal? All right, thank you, Claudia, for that question. Marcy will come up and expand on that a little bit.
Hi, Claudia. Thanks for the question. So, yes, we've had 38% of our goal reached. That's 63 households. We are still hoping to get to 105 households. What we have experienced is that a lot of folks aren't home when we approach their home, so we go back several times. We are still hoping to reach our goal. We're really pushing a blitz forward for the next few days, and so that's why it's so important that individuals, if we come to your door and you're willing and able to participate, that you do. So we are still really hoping that we meet our goal.
La pregunta es acerca de la actualización de encuestas anticuerpos de COVID-19. ¿Cuántos hogares se han visitado y si llegaremos a la meta que el condado se ha propuesto? Efectivamente, 38% de los hogares ya se han visitado, son 63 viviendas. Todavía nos faltan 105 más para alcanzar la meta. Muchos que quizás llegamos a sus casas no están, entonces por eso no hemos localizado a más personas. Pero aún estamos regresando, tocando esas puertas y hablando con la comunidad. Así que si usted es de las comunidades seleccionadas, le recomendamos que participe para que ayude a lo que viene siendo la actualización de las pruebas anticuerpos.
Claudia, thank you so much for the question. Ron, who do we have next?
Yes, next up is Steve Filmer with ASU. Steve?
Hi. With the Sero study and the other efforts you have underway, have you already identified high infection rates or great vulnerabilities in specific communities in the county, specifically Native American and low-income communities? And if so, what are you learning?
I think we have identified a couple of communities. One is no longer one of those communities highly affected. Director Flanagan can expand a little bit more on that. But I know at one point we were in high level, a lot of communication with Tolleson, I believe, was one of those communities. And then we've also had a lot of interaction with Guadalupe as well. And I think they've spoken quite a bit about that. But Director Flanagan can expand a little bit more on my knowledge.
Thank you for that question. So the Serosurvey isn't intended to tell us that sort of information, but we do know already from the rates that we're seeing, not only here locally but nationally, we do know that there are certain populations that are disproportionately affected by COVID-19, unfortunately. So we are working with those communities that turn out to be hotspots to ensure that there is adequate testing available and wraparound services. But the Serosurvey is not intended to tell us that information. Thank you.
La pregunta es, con el estudio que se está realizando, si los índices de infecciones son más altos en ciertos grupos, por ejemplo, como los nativoamericanos. Bueno, de acuerdo a la encuesta de anticuerpos, no necesariamente nos va a revelar qué grupos son los que están en más alto riesgo. Sin embargo, sabemos que a nivel nacional se ha dado a conocer que ciertos grupos sí son de más alto riesgo. Por eso, lo que hemos hecho es que en el condado Maricopa existe la posibilidad de que la gente se haga las pruebas. Están por todas partes. Invitamos al público que visite si son de esas comunidades de alto riesgo.
Steve, thank you so much for your question. And a reminder to all the reporters out there, too, we usually have time to get around to second and maybe even third question sometimes. So if we didn't fully answer your question or you have a follow-up, please stay on the line and we'll come back around once we get through everyone's initial questions. So at that point, with that, Ron, do you have anybody else?
Yes, Steve. Claudia Rubicic has a follow-up. Claudia?
Okay.
Claudia, you're self-muted. We're going to put Claudia on hold and come back with someone else in just a moment here.
All right, sounds good. Do we have
I'm back if you can hear me.
All right, now we have Claudia.
Okay, sorry,
All right.
the computer. Yeah, I'm back to the Serosurvey, and I do have a follow-up. Originally, I just want to make sure I have this clear. I thought the goal was 210 households. So I just want to make sure I have that right. And then the second part to that question is I saw on social media some concern about, the DNA and blood getting collected and people not knowing where it's going and issues with privacy. So what do you want people to know in terms of what that blood, where is it going? And then what happens to it once the survey is over?
Sure. Privacy and security surrounding the Serosurvey is something or has been discussed quite a bit before it launched, and certainly it's a concern for everybody. We certainly understand that. Director Flanagan will come up and answer that question.
Thank you for that clarification, Claudia. It is an important distinction. Originally, our goal, it still is 210, and the minimum households we have to be able to get into is 168 for the Serosurvey to be considered validated for our community. And so that's the minimum number. When I say that's how many households we need to get into, that's the minimum number left. As far as security and what happens to the samples are thrown away as soon as we test them for the antibodies, and they're not used for anything else. And actually, the identification of the sample and the test is only given to public health and to the individuals that participate in the survey.
La pregunta es acerca de una clarificación acerca de la prueba de anticuerpos que se está realizando, encuesta anticuerpos que se está realizando en la comunidad. ¿Cuántos hogares son los que se tienen que alcanzar y cómo lo que estamos haciendo al momento? Sí. Efectivamente, son 210 hogares a los que se tienen que alcanzar como meta. Y para que el estudio sea válido, tiene que ser una muestra de 168 hogares. Sabemos que la seguridad quizás es una pregunta para la comunidad y queremos que sepan que una vez que se colecta la muestra de sangre, se hace el estudio, se desecha esa muestra y no se da a conocer a nadie más, solamente a salud pública y a la persona que se hizo la prueba.
Thank you, Claudia, for the follow-up questions. Ron, do we have somebody else?
Yes, Steve Filmer has a follow-up question. Steve?
Yeah, thanks. Could you provide more information specifically about the community of Guadalupe and how severe the situation has been there and how it has evolved, if you know, over time?
I would say, that's a complicated question or a complicated answer to a relatively simple question, Steve. So I know there's a lot of things we could mention. We specifically were out there helping them with testing early on as those issues came up. And I know that I believe a number of stations have done that story as well. So I'm familiar with the testing, and public health has spent quite a bit of time advising the town leaders in Guadalupe as well. But Director Flanagan probably has a more exhaustive list of all their efforts, because I know public health has spent quite a bit of time on this.
So thank you for that question. Certainly, the numbers in Guadalupe have improved. The case rates have improved, although they are still experiencing higher rates than overall in the county. We're working with them. Some of the services we've provided are housing and wraparound services, providing food, masks, testing, and so we continue those efforts, but they are certainly headed in the right direction, and we have seen their numbers go down.
Y la pregunta es acerca de ofrecer más información sobre la comunidad de Guadalupe y cómo ha evolucionado esta comunidad en el transcurso de la pandemia. Sí, efectivamente hemos estado trabajando muy de cerca con los líderes de Guadalupe. Se han estado realizando pruebas de COVID-19. También otros esfuerzos es que Salud Pública ha estado trabajando de cerca con los líderes de Guadalupe. También los números han mejorado, aunque siguen siendo un poco más altos que el resto de la comunidad. Sin embargo, también estamos asistiendo en otras áreas como lo que viene siendo vivienda, la comida, y sí vamos en la dirección correcta en cuestión de los números que han estado bajando.
Steve, thank you so much for the follow-up question. I think I will mention briefly, because we've talked about this at Unified Command quite a bit. The county has rented a hotel that's used for isolation housing, and we do know that some of the communities, especially communities where multiple generations of families live in the same household, isolation housing might be something they need to take advantage of in order to isolate a member of the family and not infect other more vulnerable members of the family. So that is available to anybody in the county that needs it. And it's part of the questionnaire that people are receive when they test positive, and then they're contacted by public health. If they get that far into the questionnaire, they can certainly express interest in that, and then public health will reach out and try to connect them to that isolation housing if they need that. But that's been an important component and somewhat underutilized, but it is available to people in the county who live in those multi-generational households and might need that assistance to isolate a member of the family who's positive for COVID-19. I'll let Joanna come up and translate that into Spanish.
Hablando acerca de lo que viene siendo vivienda, también el condado Maricopa, el comando unificado, ha rentado un hotel, lo que se ha utilizado precisamente para personas que den positivo a COVID-19. Sabemos que hay muchas áreas o muchas viviendas que tienen a múltiples generaciones viviendo bajo un mismo techo. Si una persona resulta positivo dentro de esa vivienda y necesita un espacio separado, pudiera utilizar este hotel, que al momento no está completamente lleno. Esto es parte de la encuesta que se le hace o de las preguntas cuando da positivo a la prueba de COVID-19, si necesitaría un lugar para ir y poderse aislar de una forma segura.
Steve, thank you so much for the follow-up questions, and thank you, Joanna, for translating. Ron, do we have somebody else on the line?
Yes, Fields. Claudia Rupchich has an additional follow-up. Claudia, you're unmuted.
Okay, last one, I promise. Staying on the survey, two-part question. When do we expect to have the results, the infection rate in the county? And two, if you don't reach your goal of 168 households by the end of the 20th, can you expand perhaps, or what's the plan then?
All right. So thank you, Claudia. How fast will we have those results, and then can we extend it, let's say, for another week or whatever that timeline might be? Director Flanagan will address that question.
Hi, Claudia. So the results will take a few weeks after we close out the sample collection. If we don't meet our goal by Sunday the 20th, we will have to extend our collection by just a couple of days in hopes to reach that target. And then it'll be a few weeks after that we go through all the data and start to have some results of the survey available.
Esta es una pregunta en dos partes. La primera es cuándo tendremos los resultados de la encuesta de anticuerpos y si no alcanzamos la muestra de 168 hogares, ¿se podría extender entonces esa para finales del 20 de septiembre? Bueno, los resultados, para responder a la primera pregunta, los resultados van a tomar varias semanas una vez que se cierre la encuesta de anticuerpos. Y sí, efectivamente se extendería un poco más de tiempo si es que no alcanzáramos los 168 hogares que se necesitan para que sea lo que viene siendo una muestra válida.
Thank you, Claudia. I hope we got all your questions answered. I appreciate you being thorough. So, Ron, do we have anybody else with a question today?
There are no more questions.
All right. Well, thank you all for reaching out today and having some good questions about the Serosurvey, and hope you'll continue to help us push the message about flu vaccines and the availability of flu vaccines, that it's a very important component to the defense as we head into the winter season. We know flu vaccine is likely to spread, and it's certainly going to be hard to differentiate sometimes between that and COVID if it's just by symptoms. So a lot to watch over the next few months, and we'll certainly try to keep you informed from here at the Joint Information Center. So we appreciate your time today. We will let you know when the next press availability is. Thank you.